let me tell you something that basically I am a very, very lazy person, and I like to rest all the time. I'm known in my family that I like the physical exercise the least. I am happy with my book and looking at the sky and seeing the birds flying. That's what all I have done all the time. And I'm still not sure how I passed my exams in medicine. Anyway, and I have found out it's easy to swallow a pill rather than follow all these. And therefore, most people like that. But fortunately, I found out a solution. And that will tell you it is a God-set solution, that it is just like swallowing a pill. I found out that there was a method of really achieving the inner strength by doing a very simple program. If this was a very complicated program, I would not have been able to do it or rather advise it. But it is so simple, it takes very little time and very little effort. But as I always known, all throughout my experience of last so many years, that all simple things are difficult to learn. It's very easy to learn a very, very complicated and difficult things. But simple things are difficult. Now let me come, this is the first time in all these years, I remember in my first 15 years of my practice, I did all this. But now for last so many years, I've left that habit of showing slides and talking about it. I usually just talk whatever I feel like when I see the audience. But let me now stick to the schedule. So coronary heart disease, I need not tell you that due to lack of blood supply to the heart muscle. And they become narrow due to fat-like deposits. You all know that. Now, however, now this is very important. The walls of the artery are also very sensitive, and they go into spasm due to variety of reasons. Now that is very important to understand, that it is not something which is all the time stable. In cold weather, in stressful situation, cold weather and stressful situation, and stress is the common thing, that it can become very, very narrow, and the circulating blood can become very thick. So there is a fixed element. There is a fixed element in coronary artery, which you see the narrowing 70% or 90%. But why do you? There is a fixed element, and there is a variable element of spasm and varying consistency of blood. Now this is very important, and I find that is a crucial part in pathology of coronary heart disease, or while you are treating a patient of heart attack, that this variable element of spasm and this thickness of the blood is so important that nowadays, as soon as the person gets the chest pain, my experience is of over 60 years, and my first 30 years of practice, when the patient got the chest pain, he knew that it might be serious, and therefore I have to get admitted to the hospital or rest a while and get better. But in these last 30 years of my practice, when the patient gets a chest pain, he only fears, now what is going to be my expense, what is going to happen to me in the rest of my life. And all these thoughts, as soon as he gets the chest pain, that thought itself increases the severity of the heart attack extremely. This is so, today I see it every day in India, that as soon as he gets the chest pain, he thinks that now what about the rest of my life? That was not the thought in the first 20 years of my practice, even in UK and even in USA, or while I was learning even, because there was not that much of fear that now what will happen. But now the whole picture is so, it is very gloomy, I tell you. So now somehow we must make some great difference in this. Now, you see, if you have fracture in the leg, what will you do? You will put a plaster and give rest. But if you have a heart attack, how can you give him rest? Now that is very crucial. And we do everything possible we do in this world now, which does not give rest to the heart when it requires most. Right from the time when you talk to the patient, everything happens. When the patient who has got a heart attack, a part of the heart muscle which is not getting the blood enough, it requires rest. It requires to be bandaged, but you can't bandage the heart. And therefore, it is very crucial. Therefore, all these talks about doing this and doing that, the most important thing is the reassurance at that time that you are going to be all right. And who can give the reassurance? And the patient must know that this doctor has really cured so many, and he is known for that. And if he says, well, you're going to be all right, that's, I tell you, the first medicine which I have found out. As I said in my talk several times, that when the person comes to you and when he is there already after heart attack, if you can tell him that, look, now everything will be all right, what a difference it will make. So the physical as well as non-physical, call it spiritual measures are required to manage coronary heart disease. Very important. And our book, Heal Your Heart, tries to explain this combined perspective. That is the scientific method as well as the spiritual. Spiritual means not a very big way of spiritual, but it's the way the doctor talks to the patient and approaches the problem. Now, one thing which I have said, I think, 1,000 times already, and I like to do it every day, and I learned that from Dalai Lama. Can you believe that? Because he advised the Harvard professor Benson Jones. He had gone to Dharamshala to learn the effect of meditation. And when he was coming back and we went to thank Dr. Dalai Lama that you gave me this opportunity to study this, Dalai Lama said, I would like to tell you something, doctor. And what he said was so significant. And I tell you, if you remember only this thing, then you will understand why the results of heart attack nowadays are not so good as they should be with all the advancements. And he said the Tibetan medicine, he said the cure of illness determined by three tenets. Three tenets. And look at that first tenet. Look at that first tenet. Doctor's faith in himself that he will cure the patient. Can you believe this? Now, most advanced, very well-trained cardiologists today, when he sees the patient, does he have this faith? It was cultivated in me by my teachers in UK. Now they can't find teachers like that. Because at that time, falling ill in UK was not a big problem. It was actually rest. And there was no question of paying anything. They were actually earning enough even when they were ill. That was the best time. Macmillan said that we never had it so good. I'm talking about the years of 55 and 60, 1955 and 60. So now the doctor's faith in himself that he is going to cure the patient is the first tenet to get the best result. And that patient's faith in the doctor that he will cure me. Because now he has got a reputation. And doctor's karma. Doctor's karma means his skill and the way in which he applies that with love. Now, meta-analysis this is now typical of these days talk, therefore I'm putting it. Okay, meta-analysis of 8 trials of angioplasty versus angioplasty and versus medical therapy. Only medical therapy, no angioplasty. No mortality benefit in patients with stable coronary heart disease. Now, this has been shown by various people, including people like Dr. Nishan and very experts and all that in stable coronary heart disease, it only improves angina and quality of life. But there is no survival benefit. If people begin to think that if I don't get the intervention, I won't survive. Now, that is a great erroneous feeling that we have now created. Therefore, majority, in 8 trials have shown that there is no, in stable angina, there is absolutely no survival benefit by any intervention. But of course, it has got one, it improves the angina quickly probably, and now clinical outcome of utilization of revascularization and aggressive drug evaluation, that COURAGE trial they call, and that showed that no mortality benefit of angioplasty and optimum medical therapy versus optimal medical therapy alone. So medical therapy is the sheet anchor, that's what it is. Now 3 major randomized trials, this were prepared by my friend, and my source of strength now, Dr. Dhaval Doshi, is a 3 major randomized control trials of CABG, that is bypass surgery, versus medical therapy. Now, coronary artery surgical study, there was one study, Veteran Affairs trial, European Cardiac Society trial, showed that the greatest survival benefit of CABG, now remember this is very important, the greatest survival benefit from bypass surgery are evident in patients with very reduced left ventricular function, Dabak Sepakno, the left ventricle strength, that is measured as ejection fraction. If it goes down below 30%, if it is 40% or more, there is no survival benefit. If it is 40% or more after heart attack or left ventricle ejection, there is no survival benefit. Quality of life benefit is always there, but that quality of life will come gradually with everyone if they are reassured and if they take the proper mental and physical rest for 3 to 4 weeks. Now, left main disease but impaired left ventricular function that is below 40%, and left main disease, triple vessel disease with proximal LAD stenosis and recurrence of angina despite optimum medical therapy, then this intervention may be helpful. In all other individuals, bypass surgery did not show any mortality benefit. It only improves the quality of life. Now, this has been said enough. On the contrary, the randomized trials have demonstrated that nitrates, that is, sorbitrate and other preparations, aspirin, beta blockers, all these medicines, calcium blockers, angiotensin inhibitors, lipid-lowering medications, which are been thought of very well, so many people have said about statins, can save lives in patients with stable coronary heart disease. People who have just had a heart attack and now he is recovering and he is having only little angina on exertion, they are all named as stable coronary heart disease. On the basis of available evidence, optimum medical therapy with lifestyle interventions. Now, lifestyle interventions means making change, reducing weight, having, some method of achieving mental peace can be first-line treatment for management of stable coronary heart disease. Now, this is the thing we have already said that have shown mortality benefits only in patients of unstable angina and patients actually having heart attack. This has been said enough by my colleagues. But another thing is that, now this is very important. Patients with stable angina have very low annual mortality of approximately 1%, which is not significantly higher than that of general population. Of general population who have not suffered from any heart attack, and you have suffered from heart attack, but who have become stable, that means he gets pain only when he exerts little bit more than normal. Then only such stable patients, there is no, it is only 1% higher mortality. When the plaque grows in the wall of coronary arteries are capable of remodeling themselves. Now this is very important. How does the person who gets a heart attack survives? As soon as he gets a heart attack, the artery gets blocked. Now if he survives, that means the collateral circulation has got to start. Something has got to happen. If you get a bleeding, how does the bleeding stops? The body does something to stop it. So there is a natural phenomena that our father of medicine, Hippocrates, observed, that the body has inherent capacity to heal. And that is evident in every heart patient who remains alive. It starts there only. As soon as he's alive after a heart attack, and if he comes to the doctor and he's alive, that means the revascularization has started. Otherwise, he would have been dead. So, now this is very important. In the management of coronary heart disease, the approach varies from doctor to doctor and from patient to patient. It depends not only on the severity of the disease, but also on the perception of the severity of the attending doctor. Very important. It's a perception. And of course, whom you are treating. Now let me tell you something out of the way. Who requires your attention very much? What type of heart patients require very much? Now this is something which I want to tell the general audience as well as the young doctors. The persons who require most sympathy when they get a heart attack are the persons who are in position, either rich or in position as a politician or a businessman. More important a person as he thinks that he's in his life, he requires your compassion more. Now this is very, very important. If he finds out that doctor is interested in my position and in my money, that is again the first negative thing that will going to happen in his recovery. And I have found out, I have treated all types of people, the religious leaders, the politicians, the businessmen, the saints and all that. But when they understand that doctor is interested to see that how he gets well, rather than any of the laurels he may get by treating them, then the recovery becomes very, very easy. But it's very difficult. It's a lesson which you learn after a long time. Now the patients, even with advanced coronary heart disease, especially those who are considered technically unfit for surgical intervention, this is important. I've seen so many like that. I also benefited by intensive medical management, lifestyle changes, and in-depth stress management. Now the stress management starts only with the doctor only. There is reassurance. Now, this is something which is now the commonest thing which is happening today. I see it in India every day. And this is so important. And I think if you learn this from today's talk, that this is important. It's a very well-defined. Now, the America always finds out a good term for this. It's an ocular stenotic reflex. That is, whenever a stenosis is seen in the coronary artery, I know about two friends meeting on Sunday, one of them an interventional cardiologist, and another specialist in another field, and discussion about a little bit about the some coronary problem. And he said, when I do a treadmill, doctor, after 11 minutes I get a little discomfort. And what do you think about it? So the intervention fellow says, now let us do a treadmill. Today is Sunday and we are free. So he does a treadmill test and he finds out that after 10 minutes there are some little change. So he said, now why don't you do an angiogram? Both of them are meeting as a friend and they do the angiogram. And he finds a little obstruction in the coronary artery, left coronary artery. And he said, why don't you do an angioplasty now? Because you see the first one, the previous one. You see, where a mere stenosis without symptoms or clear indication for treatment ends up with a stent or surgery because doctor and the patients cannot reconcile with the fact that all stenosis do not require treatment. Now this, I think, if you learn that is very important. That all stenosis do not require treatment with surgery or intervention. They require little advice for medical treatment and lifestyle change. Now, Universal Healing Program, enough has been told. The whole conference is about it. I need not dwell on it. But I have found out now, so again, as I like all simple things, this program, when the people come to practice it, it is so simple. It is nothing, and therefore it is very difficult for people who have got a lot of knowledge about yoga. The most difficult persons have been able to not teach anything. Those who are absolutely, they have all the knowledge about yoga and meditation. They are people, they do not understand our program at all. They just argue, this is the best way or that is the best way. But a rickshaw driver learns it very easily. Or a person who does not have any knowledge about yoga, when he comes to our program and we tell them simple things, that you just stretch a muscle and then relax and bring your awareness on the muscles which are being stretched and relaxed. You come in the present moment, you do this, and when you just lie down and then relax all the muscles from toes to the head, and where all the body is relaxed, become one with your breath. And we explain simply. See, when you becoming one with the breath and forgetting the body is such a great thing and such a easily achieved in our program, in our technique, that when you become one with the breath, you become one with the whole world, because the breath is the same. And that experience itself leads to all the benefits that you get from Universal Healing Program. So, diet counseling, moderate exercise, stretching, relaxation exercise, all that we have already said several times. Again and again and again I have said that Universal Healing Program is not something different from allopathic treatment. It's a part of allopathic treatment. It's a part of mainstream medical approach. And Universal Healing Program does not have a stamp that this is the program, it has to be done like that. It only has an idea that you have to, we are made up of body, mind, but if we are only body and mind, we will be in the crematorium. We are body and mind, but body and mind is kept alive with our breath. And breath is common to all of us. So Swami Sachinanandji, who was a disciple of Sivanand Swami, the doctor, he taught the Organised a simple way of relaxing the body and the mind. And Hippocrates, our father of medicine, said that if you relax the body, the mind automatically relaxes, because in every part of the body, the mind is there. Mind is not present only over the shoulders. So we relax the body one by one with different parts. We used to do that in the school, raising our hands. That was physics. But now, when you raise the hand, you may raise only this much. But whenever you are raising, your awareness is on the muscles which are being raised and relaxed muscles which are being relaxed, coming in the present moment and relaxing that way, and then relaxing the whole body. Then relaxation is complete, and then you become one with your breath. Then you become one with everything, and the wonders happen. That's what I've seen by 27 years of practice. So I really thank you all. That it's very difficult for me. This is the first time in the last 30 years that I have been able to do this with the help of slides. Thank you very much.
Thank you, Dr. Kapadia. Let's give him a big hand once again. Thank you so much, sir.